Hello everyone, you are watching sqadia.com and I am Hammad Haider. Today we'll be discussing the injuries of hand. As usual, we will have 5 sections. In the first section, we'll be going through the metacarpal fractures. In the first 2 sections, first mainly through the metacarpal shaft fractures, and we will be briefly discussing the general principles of treatment in the hand injuries. Then in the second section, we're going through the metacarpal fractures, especially of the neck, of the head, and of the base. And in the third section, we're discussing two very important entities, especially related with the first metacarpal fractures, that is of the thumb metacarpal. We will be discussing briefly what is the anatomy of a Bennett fractures and what is a Rolando fracture and what is their management. In the fourth section, we'll be discussing the proximal and middle phalanx fracture, as they involve as you know, the hand is made up of metacarpals and phalanges. They have 3 phalanges: the proximal, middle, and distal. In the fourth section, we're discussing the proximal in the middle part, and in the last section, we're discussing the distal phalanx as a separate entity because it is usually associated with nail bed injuries at times as well. We'll be discussing the tuft and mallet finger, the terminal shaft injury, and avulsion of the flexor and extensor tendon injuries as well, namely which is called as the mallet finger or the jersey finger. Thank you very much. Keep watching sqadia.com.